All right, so we're the meeting of the Parkview Health Center Committee at 3:33. We'll go to an approval of the May 19th, 2022 PVHC Committee minutes.
Make a motion that we approve.
Motion is second. Any adjustments?
I don't believe so, but I don't know for sure. What I read was good.
All right, all in favor, say aye.
Aye.
All right. This is the part of our agenda that is open to the public. Discussion is limited to items listed on the agenda.
I would have Supervisor Karen B. Powell from the 2010 Village Lane, and I serve District 25. My concern is with the agenda item number 9, PVCH cold call purchase inquiry. I think this can scarcely be identified as a cold call. The week of April 17th, I had heard a rumor of someone attempting to purchase Parkview. Week of April 24th, I spoke to a supervisor with history on the Parkview board who had heard nothing. And week of May 1st, that supervisor had heard the same rumor. And I believe it was at this time I was told there was already a purchasing agent in place. On May 9th, I addressed this committee about the potential sale. My main concern, as stated last month, is the loss of a state pension, which nursing staff have worked for and counted on for decades. I've been in county board meetings where we have honored retirees with over 25 years of service, and I believe I remember one with 42 years of service. Parkview is a good place to work and a good place to spend one's final years. Parkview receives about $14 million annually from the county tax levy. This is taxpayer money. Last year, we had returned about $3 million to the Parkview Enterprise Fund. Around $3.2 million the year before. If this sale were to go through, this money should be returned to the county. It is taxpayer money. It is not for private profit. The bottom line for a for-profit agency is to increase profit for its shareholders. The fastest and easiest way to do this is to reduce services to residents. In the public interest, or the ITPI, has found that staffing cuts occurred where privatization had taken place. ITPI has found workers' wages and employee turnover were most negatively affected at privatized homes. ITPI found quality of care deteriorated. Nursing homes in areas adjacent to Wisconsin, such as Ontonaga, Michigan, have had to send residents 54 miles away to Lawrence, Michigan. That's a scenario which could play out here, forcing families to travel long distances to visit their loved ones. Forget about getting one's local clergy person to travel over 100 miles to serve his or her parishioners. Staff in privatized homes report being forced to purchase supplies from an approved supplier, whether it's best suited to the need of the patient. They report having to deal with new edicts from some faceless entity, requiring more and more involved phone calls. They report having to spend far more time on reams of paperwork because the goal of a for-profit agency was to create, produce, and inflate a paper trail. This is time which is taken away from patient care. Making a county facility a private for-profit institution is not in the best interest of the people we are sworn to serve. If there is no place left for impoverished patients to go, deteriorating health and even death will follow. Oftentimes, people admitted to county institutions are those who have spent down all they have financially. It isn't in the best interest of a for-profit agency to take on impoverished people. Doing so negatively impacts the pockets of shareholders who are looking to make a profit off the elderly and the infirm. There are too many lives which will be negatively hit by privatization. Our staff and their future pensions, patients and residents, family members with no other options. I urge this committee to shut down any such inquiry and reject any and all offers. Thank you.
We have anyone on Zoom? No. Okay. Then we'll move on to item number 4, the financial report.
So the financial report is sent out. Percentages should be at 42%. So you can see for the revenue total, we are at 35.3% at this point. Wages subtotal 32 Total labor at 32. And then it just breaks down. Okay.
Same.
Okay.
I think you emailed these along with the agenda.
Yes, they were as a,
Email. So I printed mine out. That's how I got mine.
and if you did not get that, I can certainly send. Okay. Sure.
You want to take a look at mine?
Sure. I mean, if you want to share.
Yeah, I'm more than happy to share mine with you.
I got it now. I'm sorry. I'll go over Brad Morris.
Thanks for sharing. One.
Yep. So on the top of the page, Doug does a percentage that we should approximately be at, and that's at 42%. So if you look at the totals, it'll break down each individual section. And then the revenue total would be at the bottom, which percent attained right now for our revenue is at 35.3%. On the secondary page, breaking down wages, fringes, and benefits, our total labor that we're at right now is 32.4%. Travel regarding registration, automobile, meals, lodging, we are at 70%. A lot of our conferences and ongoing education is usually in the spring and the fall, so that does even out after time. Looking at the operating budget, operating subtotal, we're at approximately 31.8%.
You've got motor fuel twice. And that's, they have different object numbers. As you have in equipment repairs, there are different object numbers. They're listed twice on page 3. Just above operating subtotal and just above repairs and maintenance.
So we see the motor fuel portion. The zero motor fuel, Doug could probably speak to this more in detail. However, we have 2 vehicles that we do have. We have a red van and we have a car. The red van we aren't currently using, so that's probably why that's at 0%. It's in for repair.
Are you asking about why there's 2 line items?
If it's because they're, for each particular, are they listed in each?
No, because if you take a look at it, the object code is, let's see,
545.48.
that is for when Parkview buys it out on the market. And the one that starts with 75 is when they go over to highways and fills up. Okay,
Equipment repairs.
same thing. If they do something in-house, like if you have an object code that starts with a 7, it's an interfund one between departments. If it's a 55, it's a contracted service. And if it's like a 53 or 54 starting, it's when we do it within the departments.
Thank you.
Then going also on the last page, utilities 33.27%, Contractual services, 30.13%. Insurance, 41.6%. And then they do a depreciation expense, we're at 40.6%. Total other operating budget, we're at 33.02%. And then our expense total is at 32.58%. Any questions at all further on that?
Concern to that for buildings and or someone put the claim and parking mistreated they feel somehow, that, and I'm just curious what that insurance all covers, that building in there, or is some switching calls, or is it also if that claim that curfew mistreated them or their loved one in some way. And if you don't know now, I understand, but so you understand about that.
Okay, and I don't know, but I'd be happy to find out for you.
You have a question on financial? Move on to the administrator's report.
Okay. So our COVID-19 outbreak status update, right now we do have 0 residents with COVID, and so there's 0 residents on our COVID neighborhood. We essentially have sporadic staff here and there still coming up positive. Our last staff was 2 days ago that came up positive, less than what it was at our last meeting. So it seems to be slowly declining at this time. During our outbreak status, we did start admitting positive COVID residents from the hospitals onto our COVID neighborhood so that we could still continue to admit. I feel like we took 4 COVID positive residents from the community and were able to help serve them. Since then, if we had no further residents after 1 week of not having any positive residents and having negative tests, we're able to admit to other areas of the building that don't have positive COVID. So we have started admitting. We've had 8 admits so far this month. And as we go on to talk a little bit further on our monthly census report, you can see how we're trying to adjust out of that outbreak status. Our average daily census at this time is still 110. Admissions and discharges in total numbers. So we had 3 admissions for the last month with 7 discharges. Like I said, so we're already at 8 admits for this month. So we've over doubled that and still are trying to increase that number as well. We do have a number on our wait list, which is 16. These are members, part of the community that enter onto our wait list. Not necessarily all 16 of those are ready to move in today. But they like to remain on the wait list in the instance that they do need somewhere to go, that they're already kind of approved to come to Parkview when we have a bed available for them.
So could they come in the near future? I'm curious about that. Or we hold off adding up the rest? That's my question.
The number on the wait list isn't as acute as the hospital admissions, where the discharge planners will say, do you have a bed available today or tomorrow for us? We work through the wait list as they come up on our list. We do have beds available, and we do have move-ins and members of the community coming in when it's convenient for them as well. So family, can move them in next week, say, and they'll come and tour the building, tour the rooms, make sure that it's a good fit for them first, and then they'll move in. So we have been accepting people off our wait list.
Neighborhood, I think we call it, sorry, neighborhood. We have a patient, that's still not open, right? Correct.
Correct. So we've been taking rehab residents to the other neighborhoods. So our payer source numbers on the monthly census report, for May, we had 21 private pay residents. We had 81 medical assistant residents, 5 that are on family care, 1 Medicare Advantage, and 1 Medicare. to eke our average total residents of the 110. Any questions on the average census or a COVID outbreak at all before I move on? Okay. So our staffing update right now, we had the previous PNF committee meeting where we had our 3 proposals go to PNF. They were passed 5-0 and we'll be continuing on then to the board in this upcoming meeting. We did decide to table the pre-pickup incentive just for the reason of applying that with payroll and overtime with the labor laws. That needs to be kind of figured out a little bit more in detail before we roll that out. We do plan to continue with different proposals moving forward based off of the recommendations that we've heard at both committee meetings. So plan on probably seeing some rate for different proposals coming up here in the next couple months that staff are working on.
You're getting ready to put them out there.
Correct.
Did they change in any way? From what you originally proposed here?
No.
Okay.
Nope. So right now, for the administrator position, interviews are in progress for that. Social wellness manager, whom also is the head of social services and activities, is retiring as of August 1st. So we have that position open and posted, and we'll be completing interviews here within the next month for that position as well. The administrative assistant position, she transferred back to the previous department she came from. So she just felt that it wasn't that great of a fit, I guess, for her personally, and she wanted to go back. So we are also having open postings for that position, and we'll work on interviewing for that position as well. Right now we have 42 open positions for CNAs. We have 4 hospitality aides, 10 nurses, 1 food service assistant, and 2 housekeepers.
So what percentage of your staff that would you open, what percentage open do you have? Saying that correct? Yeah. Answer that.
Essentially, we're staffing approximately 3 CNAs per shift on each neighborhood, nights being 2 CNAs and then 1 nurse on AMs, PMs, and they split a neighborhood on nights. So we would have to have probably 2 full-time nurses for sure, and probably 6 to 8 additional full-time CNAs to open.
What the administrator is specifically, do you know how long they're taking applications? I talked to the county executive last week. He said that they had somebody was very highly hoped that might be interested in that. I'm just curious, how long is the position open for? You know?
I don't have any details on that, so.
Answer that for you.
Mhm.
I believe all of our positions are listed as continuously open. So as soon as we get applications, the departments find out. We don't have closing dates on them unless maybe the finance director or some of the other ones, but they're mostly all continuous.
You said 2 full-time CNAs and 3 part-time.
No, we would need 2 full-time nurses for sure, especially with the every other weekend. So almost 2 full-time nurses plus additional weekend staff that would be willing to help or just take that part-time status for the weekends. And then the CNAs would be an additional 6 full-time CNAs, but then also for their days off, you'd need the part-time to offset that as well.
That's a substantial difference from what the openings are. I'd like to ask the question sort of the inverse of that. Without opening any more neighborhoods, how many positions short?
Just now,
Yeah, like with what you have now, we're adding any more beds to what's online.
and it's kind of skewed right now because we have a lot of students home picking up during the summer. So right now, staffing wise, we are okay to continue at the capacity that we're at. When that September time comes and we have all of those students go back to school, we have to adjust at that point. So we still have, I want to say there's only like 2 or 3 full-time CNAs actually scheduled on the PM shift. So a lot of these casual call status people are picking up the vacancies right now.
I think maybe what I'm not understanding is if we have 10 RN positions open, but only a couple of those are attributable to opening the other closed neighborhood. Don't we have like 5 or 6 open RN positions just within what we have open now? Or are you saying we're okay because we have enough staff that are able to pick up, fill in the gaps?
Yes.
Okay.
So we're okay now because the staff are picking up to fill the gaps. So if we were to entertain opening, say the rehab unit, that would be the minimum of what I would need in order to open up even one side, and that wouldn't be to fill that rehab unit at full capacity. So if we opened up like 10 beds or 1/2 of the rehab unit, we're looking at probably 2.5 nurse FTEs at least at minimum. And then probably we said 6, so probably 7 CNA FTEs. Because we staff 3 and then you'd have the night shift plus then their days off. So, and the weekend, in order to entertain opening up then half of that neighborhood. That neighborhood historically we ran with 2 nurses on AMs, 2 nurses on PMs, because of the acuity. Yep. Any other things on staffing at all? Okay. So our survey updates, we've had no recent survey activity at this time. Project updates, we have the PVHC training center that's underway. They're building all of the walls and everything at this point. We just had an update meeting this afternoon. It's projected, but they say they're maybe about 1 week behind right now, but they feel that they can catch up with that as well. The roofing and the trusses, everything will be delivered by the end of the month and they'll start putting the roof on. So.
Your plan is for open house and ribbon cutting type of thing.
I can check with the executive on that. Anything else?
All right, we're all right to move on to item number 6. Information only and budget submission, therapeutic wellness.
Okay, so our therapeutic wellness transition, the activity staff of the facility have presented a transition for their department to better represent the services that they provide to the residents. They're requesting the name change to a therapeutic wellness transition. These are all staff that have degrees and feel that it better represents the therapeutic side and the psychosocial side that they provide for the residents, especially now. So we are submitting for the name change along with that, also submitting for a grade change along with the budget. So just wanted to provide kind of some information on that when you do see that transition with the annual budget change.
How long has it been since that position was like the job description or the job title?
Before my time. I know that one of the activity specialists that's working a lot on this has been with them for 30+ years. And I think that it's been since then or a long time. So it's well overdue.
And you work with residents, I mean, with my question. Does the residents in general and not those who are for rehab, like in there, or wrong, or?
No, the activity specialists work with their rehab residents as well.
So that's, look at it as therapy, rehab, or
That's a contract. Yep, that's contracted. Completely separate. Yep.
Any other questions? On to item number 7, information only, budget submission, all insurance supervisor.
So this is another transition that we are looking at with the budget. Obviously, with COVID, we've had a lot of regulation changes, which has changed the job descriptions of this position in particular. We are required to have an infection preventionist and full-time infection preventionist at all times. And obviously that person has taken on a lot more duties and responsibilities, including being on call and backup and being called for outbreaks. So we are recommending position change, title change to better represent what that person's now doing other than just the quality of care. And then also a change with the grade to represent the responsibilities now that are required.
So you indicated that this change here was it related to a change in like regulations or how service was provided?
For the quality supervisor, essentially that infection preventionist has had to take on many more regulation changes. Yes, so there's mandatory daily reporting of all of our vaccinations now for both staff and residents. She has to track everything in the entire building for vaccinations. So she has to submit that along with any positive residents, positive staff members. We have to submit that now to the public health department. We have to document that. We have to track all of that. Along with all of our weekly testing, we have to make sure that people are tested per the recommendations, checking positivity rates.
So is it just related to COVID? Is this change just related to COVID?
Yes, the infection preventionist. We've always had to have one, but the responsibilities now have increased because these regulations are now put in forth by CMS and they're not going away.
So Tuesday night moves this fast.
I don't think it's gonna happen.
Information only, engineer consult, water meter repair.
And I can let Mike talk on that.
Which company has the problems? We have, Parkview was built and we occupied in 2000. And it was built with 3 water heaters and a solar water heating system. And in 2010, let's see, it was unit number 1 failed. And we had that one replaced. And this spring, unit number 3 started leaking, and we can't fix it. In between 2010 and now, they no longer make these types of water heaters. So we are kind of between a rock and a hard place. We have to try and figure out how we're going to keep the hot water going to service the residents. Right now, we can do it with the 2 water heaters that we've got. We just don't have a spare one if one would go down. Along the same time too, they came out with new rules for Legionella and Legionella disease. And Legionella is the bacteria, I think it is, that causes Legionnaire's disease. And since then, they've come up with different ways that the hot water systems should be operated and should be designed. Because what ends up happening is the Legionella will propagate in water temperatures of about 110 to 120 degrees. So the way Parkview's been built is the hot water loop kind of goes out to the rooms and comes back to the hot water tanks, and it doesn't maintain a good temperature. They say they like it at 145 degrees. That will keep the Legionella from growing. So we're having to do a lot of thinking about how we're going to modify and upgrade the hot water system and get another hot water heater in there, or what kind of hot water heater we need. So we've contracted with an engineering firm, JDR. They are exploring the different possibilities that we have, and we're hoping to come up with a proper solution that will meet the needs of Legionella, will meet the needs of providing hot water to the residents, and be something that we can afford. So that's ongoing right now. We don't have much more information from them. They're basically proposing like another tank water heater, but the way the systems are going now, they're going to more tankless. So we're trying to make sure that we don't paint ourselves in the corner with another tank water heater. And tank water heaters are indicated as one of the places where Legionella can become a problem. Because if the temperature, like I said, drops down below like 140 degrees, then it's a breeding ground for it. We have been having a Legionella program for the last couple of years. Actually, we were the institution, if you want, that convinced UWO to start testing water samples for Legionella, because nobody around here did it. So if you talk to a lot of people, Winnebago County is further ahead than a lot of other healthcare facilities. But back to the main topic is, we've got one hot water heater that's broke. It's not causing us a problem right now, but we're looking at a system or a solution to fix all of our things that we need to do, the Legionellas and maintaining the hot water for the residents.
They make a box like demand,
On-demand hot water heaters.
on-demand water heater that I don't know if they make them big enough to handle.
That's what we're looking into right now. It won't even resemble what you see at a house. It'll just be a boiler that heats water up to 160 degrees, circulates it through the building. Then we'd have to cool it down to the 110 degrees for the residents, and it would just keep the hot water loop going at like 140 degrees throughout the entire building. And it's just a boiler that keeps going. And the way our solar system works, it preheats the water going into the water heaters. So like on a day like yesterday, we may not have had to fire the water heat, the boilers very much at all, with the water up to 140 degrees.
Boilers fire up on a thermostat that is checked at a certain level.
Right.
And so, yeah.
Right. It usually looks at the return water. And if the return water falls below the set point, then the boiler comes on and keeps the water up so that the water comes back up to what it's supposed to be when it comes back into the boiler. Yeah, and that's what we're looking at now. But we'll see what comes up to be the most economically feasible and technically compatible to the building that we've got.
Any other questions? Item number 9, discussion. PVHC cold call purchase inquiry.
Okay. So it is my understanding that the county executive had received a phone call regarding a cold call purchase offer on Parkview. There's no specific offer regarding that. Since it is a decision for the county board to make to decline that, we need to have the discussion here at the board meeting whether to continue on with discussion or to stop the discussion here. So that's why we are bringing it forth, so that if we end the discussion here, it doesn't need to go any further.
Can we do a resolution to that effect? Is that what you're asking for?
No, they told us not to do the resolution and just to have the discussion. And if the discussion doesn't go any further, then it just stops here.
Motion to have consensus that line the term, but that we do not wish to pursue the buying of this institution in any shape or form at this time. And I understand we can't do it because we're on the agenda, but we somehow consensus. I understand we don't have a resolution. It's somehow the administration or the committee.
You have heard, that. I think we probably should not do a resolution that isn't, isn't on our agenda notice. I think we can have the discussion that was asked for, and I assume you would be able to relay the content of the discussion, and that would satisfy dispensing or moving forward.
Correct. And it's my understanding that the county executive does not have any interest. It's just that the decision has to be made by the committee.
I would really like to have Mary Ann get involved and write a negative resolution to the effect that we don't want anything to do with a sale. Period, end of story.
Can we do? Remember, this will come to work, but can we do a census something that we can send to administration, committee, like hopefully 5,000 votes if they want to do that, and we can do it in July or August. But I think that's done. I can see, we don't know what county board will do. I don't know what the can't do that. I think somehow we have to demonstrate to staff, to the people that can totally support them, and no way do we want to solve.
You want to kill it now before it gets to a point of being regurgitated and everybody else thinking it. You kill it at this meeting right now.
Right.
Sure, thank you. So trying to shape the conversations where I think is important to, because ultimately what we're trying to do is we're just trying to provide direction. At this point, we're not providing a resolution in any way. And I think it's my question is that if you feel, or whoever that might be, that entertains the conversation of where the information goes, if it's the sense of the body that they do or don't want to go, how do you communicate that to whoever that is? So I guess I'm going to field that to whoever, either Kobe or Mr. Schellinger.
I mean, I think it's clear from the statements, you three have made, and I have not said anything yet, but I heard that this is an item that we should stop here. That were there to be a resolution, it feels like the consensus amongst the four of us would be to not continue the discussions, but it also feels like I'm hearing a desire to have a more permanent position on this. Something that has a vote that inclusively tells the executive where this committee feels, and perhaps even authorizes the executive to repeat the action, sort of in perpetuity, instead of, let's say this comes up in a month, another month, the next month, always coming back and saying, well, we want to continue with this cold call inquiry. Does that capture what I've heard from?
I say that we need that because, we can agree on results, we're not going to do anything, but that kind of going to stop other supervisors asking me or anyone like, hey, here's a result, blah, 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 blah. And like I say, we want to do go for the county board, but I think some official, whatever we call it, at this committee level, this committee said at this time, and very crucial, we don't want any effort to pursue challenges, and anyone can tell administration that anyone wanted to even try that. I had a cold call to make purpose that they should persuade them not to go that way, and that's whatever we do, but yeah, Kobe said what that's how I feel now.
There's 36 different committees and boards and whatever. And there are 36 different ways of thinking how we can start just the thought of saying that there is a chance of it happening. And getting a foot in there somewhere and getting it passed around from one committee to the other, I think is a bad thing. I think we've got to kill it where it is, kill it now, and let's stop with the.
So I actually don't disagree. I think I agree that a resolution needs to be written that conveys the direction of this committee. With that, I guess my concern and I'm just going to do this because I'm not fully aware, and it's a learning opportunity for me, is, are there, there are other committees where this can come up in,
Yes.
right? And they can make a determination that's different.
No, if you make a determination here and then you go one step farther and you go to Mary Ann and get a negative resolution that then goes to the board and we vote on it. And
Can I ask a question? Because I want to understand where you're coming from, just your direction that you're talking here. When you talk about going to get a resolution, a negative resolution from Mary Ann, you're talking about the lawyer for the county, correct?
yes,
Okay. I'm just trying to understand because I don't really understand what the processes here.
you go to the corporate lawyer and you say, we want to do a negative resolution on any sale of hardship, okay? And it's not going to have to be a very long one. We just want everybody to have an opportunity to vote on it, and you're going to see it right away if there's some sort of, if something is hanging in the air, it's gonna come out in a vote like that.
So what if
Otherwise,
that
you close it off and it's done.
well, what if that backfires on us? We go for and ask for a negative vote, and it comes back affirmative that the board is interested in entertaining such ideas by not voting, in that way. So, and then for me, it makes me wonder, what is the strength of the action of this committee to say yes or no if we were to do that action that you're asking and it still doesn't end up supporting what the committee wants?
Here, I think we are, our next agenda item is future, suggested topics for future agendas. And perhaps we're thinking a little bit ahead there, into that space. I think for the immediate discussion about this cold call, feels like we have relatively clear direction that this committee is not interested in having the executive pursue any further.
I think it's a bunch of hearsay. Quite frankly, it started out hearsay and it is hearsay. And I think that it has to be cut off right where it started.
It's cold call. Do you know anything about what's happening at all?
The cold call, no. We were informed regarding, okay.
I've had experience before with county executives who naturally inform their department heads when they things affect the department. And this is another case. The department director should have known about this kind of thing. They actually want to learn. That's my opinion. That's beyond that. But
It is my, sorry.
That's what direction of that. I had to find out this rumor from, not from him, the contractor, not from coming to this meeting, being part of this committee, but from a fellow supervisor who heard the rumor. That's what we have to squall. And somehow, I'm not totally for a negative because, Bob is right. People will say, well, maybe we're not willing to sell it, but maybe not totally cut off. So somehow, but still, yeah, we have to tell the county that administration, I'll say that, but we're not entering at this time, in any shape or form.
And it is my understanding, I did consult with Mary Ann prior to putting this on the agenda. And asked for some guidance of, discussion, action. She advised just to put it on for discussion at this point. It is my understanding that if the idea of not pursuing it is made here, that we're not interested in that it doesn't have to go further. So that's my understanding at this point. But it needed to come to our.
Gossip always travels a lot faster than, what we can say. Effectively here.
My concern is that our conversation really isn't enough. I mean, our conversation isn't enough to stop that to continue happening, right? I mean, and I guess what I struggle with is not fully knowing how accurate the request is.
Yeah.
Sometimes define how we should properly respond to the request. And if we, yeah, in a way. So, but I think in general, I think it's really good for this board to communicate in a unanimous way, consensual way of what the direction should be. So, and I haven't actually stated it yet, but I'm not in favor of having the conversation. So, just so that that's clear and not subjective to anyone's thoughts.
I think this conversation is probably satisfied with what Mary Ann is looking for. I will ask if folks have any more comments. Otherwise, what I would like to do is move us to suggested topics and we continue a conversation specifically about other items that this committee might want to consider in that moment. For the moment, any other questions or comments, discussion about the cold call purchase inquiry?
The only thing that I want to talk about on cold call is who was the guy that started it. We don't want to hear it ever again. We've got a problem,
Yeah, I mean, I will say, to wrap up, I think the way that this unfolded is unhelpful to this committee making deliberations. I think it's unhelpful to the community. I think having rumors like this circulate around the board about the future and then having things come to the board without concreteness creates that room for things to continue to spread. I'll say I have heard multiple different versions of who is calling, who is offering, and things like that. I think all of that ultimately has the potential, certainly the potential to have negative ramifications for this health center.
Karen said it all in her little talk before in the open comments. And we've listened to it on the tour bus. We've listened to it. I've heard it brought up in the human services. My God, you gotta squelch the rumors right away. I don't know, maybe you can write a paragraph or something, and we'll all sign it.
I can sure take 1 minute at the board meeting on Tuesday and record letter. Okay, we move to item number 10, suggested topics. Anybody have anything they want or direction you want to provide Ashley and myself, or maybe pursuing another future agenda item?
I'd be interested in hearing thoughts on the plans for using your ancillary building as an educating center for CNAs and for whatever, even to the point of crafts and what you can bring people in to enjoy learning about whatever aspect, leading to the seriousness of nursing. But there should be a range of educational things going on there.
Take your feet as a caretaker survey. We surveyed all the caregivers in the county, and we quickly responded about how we saw the results. And the question kind of to ask is, I hope is, I think this brings their relatives or whatever to come to our community because they can't take care of them at home well enough, and they say, well, let's bring them to our nursing home. Is that any, because if you saw the numbers, boy, the numbers are better as this place. And that's my insecurity. I know it's been sharing, I talked to the state, concerned about them. Nico's going to get a global caregiver shortage, probably bring about it more than I do. And that's going to do that. Somehow affect part of you because families say, well, I can't find someone to take care of my elderly, so I'll take them to a nursing home to take care of them between this stuff.
We have a lot of home caregivers and we have a program too that's called like a respite care program. So if we do have home care people that essentially they want to go on vacation or they just need a break, we can take that person for a short period of time to allow that home caregiver a break. So we do have the, the short-term rehab, the respite programs. We can take people long-term. So we have different options for the community in that manner.
Is that basically just the elderly? I'm asking you, remember my board with autistic child, and even of course reduce our workload because you can't find adequate to take care of his son during work hours. And if you tell me that basically that's just for the elderly, understand that, but I think that's one area that autistic and autistic, especially doing the children that really struggle because this ain't actually remember works with folks like that. Yeah, they give her lower hours, but she said she got packed up emotional life. Yeah, totally doubt it. Is this home care that you said that obviously Mr. Elliott is doing here and go up there. So maybe I'm bringing up a good point.
We do have to follow our regulations to meet that skilled nursing requirement need. And especially since it's the nursing home, there are regulations that we have to follow whether or not we can accept people. So, and if you want more on that, I can go into further detail if you'd like that as a suggested topic at the next meeting. But
It's not a topic that actually relates to Mike's comments, and I don't want to talk about it because we're actually not going to talk about it. So, but I guess it's just how he started up in regards to it's about visioning what we do here, right? So Mike kind of opened up his statements for saying that that people come here because they want to get away from having to do it all at home. So I worked for 10 years in the housing industry, in the public housing industry. And I can tell you that as we transition low-income members of our housing communities, because they needed extra in-home cares, like what a nursing home would provide, Parkview was considered the catalog of doing that. It has been for a long time. And so, and I think it's really positive to think about, yes, there are impacts to family that are taking on those duties and then trying to release them from it. But also the end outcome is that Parkview is considered a destination for many people in our community as well. And I think that's really positive to note. And I think that if we're gonna talk about that, we have to talk about it from that way, not from the perspective that, you've got families that are challenging with being able to take care of their loved ones at home, and that they're just kind of being dropped here when they get here, because they're not. They're getting the best care that their money and resources can afford to provide them. And many of them this is like their dream end spot for many people. At least people that reside in Winnebago County. So, and so just kind of a positive look at how we shape that conversation, that discussion. Because that is really how the community feels about it. It is.
Actually, you take in rehabilitation. People with problems, say a hip joint or something, and somebody that's gone out and replaced. Now they have limited movement or mobility, but they need a place to go because they live alone. All right, they're brought in, say, to here to get the physical therapy, such as Heritage up in Appleton. Okay, there are people that I know up there and have gone to Heritage to have a place to recuperate, rehabilitate, and your operation is not only is it local, but it's well known. And were something to happen where a sale to this organization went down, and you take a look at how private operations generally they'll take from anywhere, but the local people would lose their priority to coming here rather than having to go somewhere else. And I think it's very important that this stay a Winnebago facility, okay, in that it maintains the priority of the people in the area, in the Oshkosh area, the Needham-Menasha area, in Winnebago County, that they have a place to go and they can look to this place for rehabilitation or problems with having some place to put a child that needs additional help. So I really think that that whole thing of sale of property ought to be looked at very negatively with regard to the entire community and how we treat the community here.
So just to kind of shape what I think I heard you here, because I just want to make sure that the suggested topic. So really, I think what you're saying is that you want to make sure that the facility stays here, but you also want to make sure that the people that are here using the facility are historically Winnebago County residents.
Well, they're prioritized.
Okay.
They're prioritized. They're given first shot at the bed that's open or whatever. They're prioritized. Heritage Hill or whatever, up in Appleton, and that local group up there, they look to, and I would imagine that Cnas is doing the same thing over there. But there's, I think it would be a shame for an out-of-state operation or somebody that is running several nursing homes all over the state decides they're gonna jump into something like this. And then you would lose that prioritization that you have for people within the area. And I've heard that from other supervisors who have had their parents or their loved ones stay here. So just my thoughts, that's all.
Just to clarify too, that for a suggested topic, are you looking for a discussion on why Parkview should remain the way it is?
All right, hearing nothing else. So our next meeting date.
I would just, now, if we're still able to, I hope we're still able to, but after today's meeting, that, I will have to be doing interviews. I'll be in Colorado and Nickel and the conference that day. So, if we need any votes, I will say that if we have to vote in vital, please let me know in advance, because I'll step out. I have a committee during that time, and step out, because I'll probably just be watching the TV on Zoom, with earphones on. But yeah, that's.
So we want to.
Just for your information as well, I will not be here on that date. So I don't know if the committee wants to decide to continue on. I can have a representative to Parkview come to, or whatever you guys just.
And then I usually have a meeting that day, and I'm probably not all of them, I'm just bringing it out. I mean, we can just 1 month, I think, but if you feel strongly, I'm just saying.
Do you have a better day that would fit everybody's schedule? If you want to change it for this one time or something, hopefully you can get away with that.
Yeah, I mean, I think if, what I don't want to do is probably make a determination today that we won't have any items in July, just give it the couple of months that we've had. I think every month has had some important items that we strong put on. But looking at the calendar, and trying to keep it's a schedule that allows you to take anything that we would have and get a package for personnel and finance. If we waited 1 week and did it on the 28th, would that be okay? I know it's a little tighter for P&F, but it would still have a week-ish or 6.5 days to get it from P&F.
It's in the summer, so it's flexibility.
Go into the and come out on the agenda. I'm thinking of doing, I know she isn't gonna want you to squeeze the 10 days. So,
We go earlier, 14.
It's fine for me. It's the third I have.
Yeah, assume same day of the week works. That's what I'm trying to say. It's something easy. But with the 14th,
RPNF will be the 4th of August. Okay. And if you come back all the way, it would be the 25th would be, we're just trying to get everything in there. So, yeah. The 23rd.
the 21st is the day that Mike will be in Colorado and Ashley will be out. Ashley, what are the days that you're out that week?
You said Thursday and Friday.
Okay, Mike, what are the days that you're out?
The 20th to the 25th. between
I mean, is the 14th okay at 3:30 for you guys?
I can take it then.
Okay, let's do that then. Let's do the 14th at 3:30. Unless anybody has anything else, I'll take a motion to adjourn.
So we'll be Chairman.
That's 14. We're just moving it 21st.
Yes.
Yeah, we're moving that right to 14.
Yeah, July 14th at 3:30. All right, one second. All right, there we go. All in favor, say aye.
Aye.
Opposed, say nay. All right, we are adjourned. Thank you, everybody.